Mark Gilman, Strategic Recovery Lead, Public Health England. We've been talking about the power of positive social networks in recovery and the need to basically get as many people as possible engaged with the 5 ways to wellbeing, so that they connect, they're active, they're doing some exercise, they're giving, they're doing some kind of volunteering, they're keeping learning, finding something they're passionate about, and they're taking notice, they're mindful. You know, the key message that yesterday is history, tomorrow's a mystery, we'll only ever have now, and recovery happens in the here and now, and how we behave with each other in the moment. Yeah, we're getting to the point where we begin to understand really what multi-agency working is. So with the person, with the patient, client, service user, recovery at the centre, and then us coming together as services basically to work together to get the best outcome. So for example, if you've got somebody who's a heroin addict and maybe crack cocaine, we'll treat that piece, but also we need to look at the smoking, because it may well be that that's going to take and that's going to be fatal for them. Similarly, alcohol, lower level mental health, or indeed, you know, severe and enduring mental health, that basically with the person at the centre, we as the services wrap around them to get the best possible outcome for them. I'm really optimistic that understanding the complex dependency, and that means that we need to come together to make it simple and show people the right pathway. When people are released from prison or they're engaged in criminal justice, then they're at high risk. They're particularly at high risk on release from prison. Those first few hours, literally the first few hours out of prison are a crucial time. And we need to have places of safety, community anchors almost, places where you know you can go, that are going to be safe in each of the 152 local authorities. We've got some excellent examples in some places. We just need to build on those examples and make sure there are more of them. But I'm quite confident.
And then the point was made in the panel session earlier about taking examples from internationally as well. Do you think there are other good models that we could try apply from abroad?
There are some interesting comparisons, you know. So for example, the whole notion of employment. Why is it? Well, it appears to be that some people in opioid substitution treatment, for example, in other parts of Europe, France and Italy, have much higher levels of employment than people in the UK, and indeed in Denmark as well. Why is that? You know, I mean, I don't know. I haven't got the answer, but it's an interesting thing. In terms of like North America, their mutual aid systems are very hardwired into the system. You know, it's almost unthinkable in parts of North America and the US that you would be just in biomedical treatment and not be associatively linked into mutual aid. It's one of the same things. So that's learning both from North America and from Europe. But we're doing well.
And finally, if you could make one change to encourage a improved path to recovery, what would it be over the next 12 months, say?
I'd make sure that every single person in treatment experienced mutual aid. Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, or Smart Recovery, that they at least went to one, ideally more than one meeting, and really see if this is the place for them.